Hi, hello everyone. Today I am going to start a new topic. So, let us start the topic without any late. So, coming to the first question, Asperger syndrome is classified under which category in the Diagnostic and Statistical Manual of Mental Disorders? Did anyone of you anytime heard about this Asperger syndrome? Asperger syndrome generally it is seen in the psychiatric patients and mostly it comes under the autism spectrum disorder. So, in which category it is classified under? Option A autism spectrum disorder, option B schizophrenia, option C bipolar disorder and option D hyperactivity disorder. So this Asperger syndrome comes under this autism spectrum disorder. So here correct answer is the autism spectrum disorder. First of all, this autism spectrum disorder means what? So let us see some explanation regarding this Asperger syndrome. Asperger syndrome. Asperger syndrome means it is one of the developmental disorder. During the different developmental ages, some changes will be observed in the children during the developmental age. So, this Asperger syndrome is defined as a developmental disorder. In the development age itself, the changes will be observed. Here what happens, how the child is interacting with the others, how the child is communicating with the others, how he is able to express his feelings or how he is unable to understand the world things, like how he is adjusting to the society, whether they are able to cope up with the situation in the difficult tasks, difficult timings like that, and how they are processing the sensory information. If suppose for example, if we are going to give some thought if we are going to say to give some presentation like that, first of all they need to perceive that thing, whatever we had given, some project work we had given to some children. First of all, how they are perceiving the thing, whatever we are expecting, like for example, if we consider some school, they had some science expo. So in for the children they will give some science presentation, some science expo like that to perform some water processing and all. But water purification, for example, that for water purification that child must think what are the aviates I need to use, how the process must be, what is the explanation I need, what is the matter I need to perform, like that. It is the process of sensory information, how they are sensing the information, whatever we are giving, whatever the input we are giving, how they are sensing that information. But in this syndrome what happens, there is a disorder, they can't able to interact with others easily, they can't able to interact with others easily, they can't able to understand the world properly, and they cannot process this sensory information, whatever they need to receive, proper information may not be there, proper sensing may not be performed here. That is Asperger syndrome. Mainly this Asperger syndrome categorized under the autism spectrum disorder. So what do you mean by autism? Autism is one of the mental condition in which the person may not be able to communicate with the others, they can't able to express their feelings, how they want to express their feelings, how they want to express their emotions, like that. It is one of the mental conditions, and they may find the difficult to form the relationships also. For example, if normal children, if we take into consideration, they can able to easily mingle with the others, but the child who is suffering with this autism disease, autism disorder, they can't able to communicate with others easily, they find very difficult. They can't able to express to the others, like that they feel the very low mind, they will have the low mindset, they can't able to express themselves. That is autism. And autism spectrum disorder means it is the power of intention, how the how the process will be going on, how they are able to focus, and how they were able to enhance their consciousness, like how they are able to perceive the things in their new life, like they are able to perform the activities in a normal way, like that everything, every matter, it alters easily in this autism spectrum disorder. So in this Asperger syndrome, what are the symptoms we will see? Eye contact. They will have the, mostly they will have the trouble in making this eye contact. They will feel awkward moment, like in societal settings and all, they can't able to move freely, they will feel very awkward in social settings. Then coming to the body language, they will have the struggle, they feel the struggle to read their body language, they can't able to express themselves easily. And sometimes what happens, they will have the trouble in responding also. If some conversation was going on in some in between some people, means they will have the trouble in responding to them, they can't able to respond to them easily, they will have the so much fear in responding in that particular situation, like that they will feel very low thing. Then coming to the emotions, how they feel very, they show very few emotions, they can't express. If they are feeling happy also, they can't express easily. Very friendly, they can't express, they feel very low emotions. Then speaking, speaking means they can't able to speak in a free manner, they speak in a flat manner, like okay, like that, in a flat manner they will speak, or they speak in a robotic tone. Means robotic means it is a AI generated, system generated thing na. How the robotics will speak, like that the speaking will be without any expression of emotions, like that the speaking will be. And they can't able to change themselves, they dislike the changes in their behavior pattern. If we want to change them, they won't like it, they can't able to change it, like that. And repeated words, continuous repeating the words, or any phrases or sentences or any commands, like that they will be the continuity in the things will be observed over there. Coming to the medical management, mainly it concentrates on the selective serotonin reuptake inhibitors. Selective serotonin here, selective serotonin reuptake inhibitors means, for example, escitalopram are the selective serotonin reuptake inhibitors. Next, antipsychotic medications and stimulant medicines. Stimulant medicines, that is clozapine and the haloperidol, plays a major role in the stimulant medications. Sorry, like this strike happened in between. Then parent education and the training. Parent education means continuously they need parent education, means if the children is having some disorders and all, they can't able to express easily, so in order to treat that, early education, for example, if we give some counseling to the parents itself, early preventive measures can be taken so that the child may not enter into further complications. So proper training and education is compulsorily needed to the parents. So in this Asperger syndrome, they will have the symptoms of unnecessary laughing without any reason. They used to continuously laugh to any situation. No response even in the loud sounds. If they're having echo sounds like that also, they can't able to respond. They simply close the ears and sit. They won't give any response to the loud sounds. No fear in front of them, any train coming also, without having any fear, they will normally cross the railway track lines like that. No interaction with others. They will simply avoid the interaction with others. They will move in a different manner. And loneliness. They always want to stay alone without mingling with anyone. They will always stay lonely. Echo words. Continuously they used to listen the echo words. Like if the person is saying the opposite person is saying shut up, also the other person is also saying shut up, like that they used to think. The echo words will be observed. Mostly these children who is suffering with this disorder, they mostly try to have the attachment with the objects. They try to avoid the attachment with the persons. So personally they will have the attachment with the objects. That is all about the Asperger syndrome. All are first rank symptoms of schizophrenia except one. What do you mean by schizophrenia? Schizophrenia means it is one of the mental disorder. Here in this schizophrenia, what happens? The mainly characteristics involves the hallucinations. The schizophrenia will be characterized by the hallucinations. That is, mainly they will hear some of the voices. They used to hear some voices, and delusions and disorganized thinking and behavior. The thinking won't be in a organized manner. So disturbance in the organized behavior will be seen. Thinking pattern, behavior pattern, everything will be changed in this schizophrenia. So what they asked us, except one, what are all the remaining first rank symptoms? Option A, thought insertion. Option B, thought withdrawal. Option C, bipolar disorder. Option D, delusional perception. So by seeing this itself, we can able to identify the first rank symptoms. This bipolar disorder does not comes under schizophrenia first rank symptoms. These all remaining three, thought insertion, thought withdrawal and delusional perception, comes under the first rank symptoms of schizophrenia. So here what they asked us, they especially mentioned except one. So here the answer will be bipolar disorder. That is the correct answer. So we'll go through some explanation. Schizophrenia. Schizophrenia means, as we had already seen in the explanation, it is one of the mental disorder. Here what happens, they will have the hallucinations, like they will have the hearing voices, delusions, disorganized thinking and the behavior. This term was mainly, this schizophrenia term mainly coined by the person Bleuler. In 1908, he found out the term schizophrenia. Later, this Kurt Snyder, he identified the first rank symptoms of schizophrenia. They mostly ask about the first rank symptoms and who is the person who gave this first rank symptoms, like that they will perform. Kurt Snyder is the person who found out these first rank symptoms. So first one, thought insertion. Thought insertion means here the ideas will be imposed by some external force. They always think that some external force is playing the some important role to give some ideas. They are giving the ideas, means thought is inserting inside. That is their thought. They will think. That is thought insertion. Thought echo means, thought echo will have the, we will also call it as auditory thoughts. Here what happens, they will have the some hallucinations, like some hearing voices will be heard over the ear, like the some commanding, someone is commanding over him, like that they will have the commanding hallucinations. Then thought withdrawal. Thought withdrawal means what? Thought withdrawal means here the whatever the person is having ideas, the ideas will be easily withdrawn by some external force. That is thought withdrawal. Next one, thought broadcasting. Thought broadcasting in the sense, here what happens, the ideas can be heard by the other people, the other person will be there, no? So the thought will be heard, the ideas will be heard by the other people. That is thought broadcasting. Next, made phenomenon. Made phenomena means it is the things like act, effect and impulse. Act means it is the thing which is imposed by the external force, or the act controlled by the any external force, that is made phenomena. And effect means the person, how the emotions are expressed, the emotions they feel, that emotions influenced by external force. Like if the person is continuously crying, means what they think, some external force is making him to cry. Or the person is extremely happy, means what they will think, the person is feeling extremely happy by the some external force, like that they used to think. That is the effect, the emotions will be affected. Then impulse. Impulse means the desires, whatever the person is having the desires, it is under control by the some external force. Whatever we are having the desires, that desires will be controlled by some external force, that is the impulse. These all seen under act, effect and impulse will be seen in the made phenomena. And the other first rank symptom is somatic passivity. Somatic passivity in the sense, what do you mean by somatic sensation? It is some skin sensation, na? Correct, na? Some skin sensation that will be imposed by the external force. Here all the first rank symptoms based on the external force only. Somewhere it will be thought is inserting, somewhere the thought will be withdrawn, some skin sensation happened, somewhere the ideas will be heard by the external force. Like that continuously always depend on the external force. That is schizophrenia first rank symptoms. And final one, delusional perception. Delusional perception means here whatever they see, whatever they perceive. Like for example, if the person is seeing some light far away from some distance, like some 10 feet, 20 feet, like that, we perceive some light. What they will think, they perceive that light as if some angels are coming from the upside, like that they used to think. Like some normal perception will be associated with the delusion, means what? False fixed belief. Something won't be there, but by seeing, by perceiving, by looking at something, we will fix to that some fixed belief that can't be real. That is delusional perception. So these are all the first rank symptoms observed in the schizophrenia. Thought insertion, thought echo, thought withdrawal, thought broadcasting, made phenomena. It includes act, effect and impulse. And somatic passivity means some skin sensation will be observed. Delusional perception means the person we are perceiving, the thing which we are perceiving will be associated with the false fixed belief, that is known as delusional perception. So in this first rank symptoms of schizophrenia, mainly the delusions, hallucinations, and the delusions may be delusional perception. As we had already observed, the delusion, the normal perception will be associated with the false fixed belief. The delusions of control, here the delusions will be controlled by some external force, like the delusions of control. Thought broadcasting means the ideas can be heard by the external force, that is thought broadcasting. Thought insert means someone is inserting the thoughts into our brain, whereas thought withdrawal, someone is removing the thoughts from our brain. And hallucinations, thought echo, thoughts must be spoken out loud, that is thought echo. Then voices discussing the patient, here some voices will have the running commentary on the some patient's behavior, like some bizarre behavior will be observed. Like if someone is will be giving the voices, like that they will have the sensation. And voices coming from some part of the body, here from some part of the body the voices will be coming outside. Some they will have the some skin sensation which will be felt. That is first rank symptoms of schizophrenia. So this is the end of the session. So kindly, if you are having any doubts, please let me know. Thank you.